How's everybody doing? I'm anti-woke and autistic. Maybe you've seen the video on TikTok where a morbidly obese woman is depositing handwritten notes in various areas of the shelves that have the weight loss products. And as you can see, she's about to place a note. You can see the Slim Fast products. She claims to be a fat activist, yet she's afraid to print out the actual word obesity. She's got to replace the O with an asterisk, as you can see. If she claims to be fat and happy, that's her TikTok handle name. It's got like something like living my fat happy life or something like that. Then why is she afraid to spell out obesity? Why is there an asterisk? So right off the bat, something fishy is going on. Her name is Jenny, Jenny, space Leigh, Leigh 498. She's obviously uncomfortable with the word obesity, which doesn't make sense if she claims to be a fat activist. So anyways, she's placing these notes as though she thinks she can change the world, but she's merely a spitball on a battleship. There's no way these notes are gonna revolutionize social norms or expectations or create this grand movement. Absolutely absurd. It's her coping mechanism because deep down inside, she's very unhappy with how she's allowed her body to become so big. So she's about to place another note where all the Slim Fast is. A viewer wanted to know what the notes said. Jenny follows up with another TikTok showing the notes. Now, here's something really strange. Why is the caption covering two of the notes? If the caption can't be moved, then why not redo it and arrange the notes so that the caption isn't covering them? Hello? I don't know what this yellow note says. I can probably figure out what the blue one says if I study it, and I can probably figure out the words that are covered up. But this is ridiculous. Somebody's asking what the notes say, and she leaves two of them covered up. What the fudge? All right, let's go to probably the most ridiculous of all these notes. It says, if the diet industry worked, it wouldn't be a $250 billion. If diets worked, it wouldn't be a $250 billion industry. Where does Jenny get off determining whether or not something works based on the profits of the facilitator or provider of that something? According to this ridiculous line of reasoning, the dentistry industry doesn't work because it makes billions of dollars a year. The shampoo industry doesn't work. Shampoos don't clean your hair because the industry makes billions of dollars a year. The toothpaste doesn't work. Toothpaste doesn't freshen your breath or help prevent cavities or plaque or tartar buildup because it's billions of dollars a year. I mean, you can go on and on. Oh my goodness, the skincare industry, the soap doesn't work, detergents don't work because billions of dollars are spent on those products every year. Hopefully by now you realize how utterly stupid this reasoning is, that diets don't work because it's a $250 billion a year industry. Absolutely ridiculous. Now, the other note that really stands out among these is the one that says, you don't owe anybody weight loss or health. So, Jenny, here's a question. How do you know that the next shopper that come to that aisle where you left those notes, particularly that one wasn't instructed by their doctor to lose 50 pounds, 75 pounds, 100 pounds, to lower their A1C or to reverse their prediabetes. How do you know their doctor didn't tell them you need to lose 50 pounds to help manage your chronic reflux disease? You need to lose weight to put less pressure on your stomach and your esophagus to reduce your heartburn. Heartburn and reflux disease can be very, very uncomfortable. It could cause all sorts of symptoms, coughing, burning in the throat, chest, various kinds of chest pain, chest burning. It's just an uncomfortable condition to have. And even though I'm not a physician, the information that I'm giving you right now can be found in pamphlets in doctors' offices. It could be found on mayoclinic.com. This is simple, easy stuff to know. So how do you know that next shopper wasn't instructed to lose some weight to help lower their cholesterol or lower their blood pressure or reduce knee pain, reduce back pain, or eliminate their plantar fasciitis, which is a painful foot condition? Who are you, Jenny, and people who think like you to dictate whether or not the next shopper looking in that weight loss aisle, looking at the Slim Fast products, who are you to dictate that they shouldn't lose weight? Who the fudge do you think you are? One of my sisters had breast cancer, and she was overweight at the time of diagnosis. Now, breast cancer can be driven by estrogen, excess estrogen. The more fat you have in your body, the more estrogenic your body is. Excess fat is a risk factor for some types of breast cancer, and my sister had the type that's driven by estrogen. So, and she's a medical doctor, by the way. She decided to lose weight. Now, I don't know how she lost the weight. I don't know if she used Slim Fast, but she took off 20 or 25 pounds. Maybe her oncologist told her, well, if you lose 20 or 25 pounds, you'll lower the odds of having a recurrence of your breast cancer. Yeah, here you are, Jenny, putting these notes in there. You don't know the backstory of the next shopper looking for weight loss aids. Fat acceptance people are the first to complain that people shouldn't judge them and make assumptions, and their followers always say to the critics, "Are you her doctor?" Well, guess what? Are you the doctor of the next shopper in that weight loss product aisle? Do you know the medical history of that person? Do you know if they have prediabetes or other conditions caused by their obesity? You don't know their backstory. You don't know their history. You are not their doctor. This fat acceptance, obesity promotion crap has got to stop. So this pink note here says, you don't owe anybody weight loss or health. Actually, you do. You owe your kids so you could increase the odds of being around for them as they get older and get into later adulthood, so you could still be fit enough and healthy enough to travel with your kids when they're middle aged. Yeah, you owe your partner health and fitness and weight loss. Now, that doesn't mean you have to get skinny or thin, but my goodness, if you're 250 pounds, you need to lose 100 pounds. You're going to move better, you're going to feel better, you're going to lower your risk of diseases, you're going to be able to fit in seats better, just have more energy, be able to go up and down stairs. Come on, I mean, any bimbo knows this stuff. The green note. There is no weight or size limit to beauty. Yes, there is. Nobody in their right mind, except men who have a fetish, thinks that a morbidly obese body is attractive. It's just not. Come on. We're hardwired to find obesity, especially morbid obesity, unsightly because it signifies mobility impairment, lack of health and fitness, low energy, low stamina. Obese body is not efficient, it's not effective. And even though in a modern day world we don't need to be able to run fast, and besides, how do you know that the next shopper isn't going to buy a slim fast bar or a can of powder for the taste of it? I mean, that stuff tastes sweet. I've never had Slim Fast. I've never had it, but according to the ingredients, it probably tastes pretty good. Maybe some people actually like the taste of a Slim Fast bar as a snack and they're not trying to lose weight. You're being a hypocrite, Jenny, and your like minded followers by making assumptions and presumptions about people when you yourself don't like it when people make assumptions about fat people. So you're turning around and doing the exact same thing that you don't like people doing with you. So before you become so judgmental and place another batch of notes, consider the possibility that the next 5 or 10 shoppers are looking for some kind of aid or assistance to drop weight, to maybe lower the risk of a recurrence of breast cancer, maybe to reverse prediabetes or lower their blood pressure or relieve pain in their knees. Get out of here. Have a good day.